Welcome to My Trialist Trial Talk, Voices of Experience.
I was diagnosed on January 16th, 2020 with stage 2 breast cancer that was estrogen and progesterone positive. And it was in my left breast. I participated in a clinical trial at the beginning of my treatment, and it was actually recommended to me by my oncologist, who saw that I fit the criteria for the trial. In the beginning, I was a little hesitant because it was so much information that was given to me, and I wasn't sure, like, do I want to add one more thing to the list to do? I did a genetic testing and I didn't have any current genetic markers for breast cancer, but that's not because it may not exist. It's because there's not enough data that is there to share with us that, okay, you may have a genetic marker, because, a lot of the research is not done on so many different types of women of different ages, of different ethnic groups and whatnot. Ultimately, I made the decision because most people that join trials are not usually, they don't usually look like me. And so after talking to a few of my friends, I was like, I need to try this. I need to do it because, one, I'm a young woman, and we don't see too often a lot of young women with breast cancer. And two, I am a Black woman, and to join a trial and have that data stored somewhere for future research, I think it's helpful to, women that look like me that may be diagnosed, in the future.
My name's Lonnie Van Horn. I'm 54 years old and I live in Indianapolis. My tumor marker for prostate cancer is called PSA. And my PSA also came back at 685. And the normal range for that is 4 and below. So it was pretty evident that the cancer was metastatic right off the bat. My oncologist had presented or come to me with a clinical trial possibility. I needed to understand, like, how does this medication work? Like, what does it do? He had already sent me for genomic testing at that point. So I knew the gene mutation issues that I had already. And so most of the conversation was him trying to drill it into my brain exactly what this medication would do based on my gene mutation. So he first explained the technical science part of it to me, which I wasn't all that understanding of. But then he kind of broke it down into layman's terms. This was a couple of hour conversation. It was a very long time, because I had a lot of anxiety. I was terrified. And he was doing his best to just drill it into my head. So it was really revolved around, what exactly this medication meant for the gene mutations that I had and what we hoped it would accomplish.
I'm Shalita Harris. I am 34 years old. I was diagnosed with stage 4 Hodgkin's lymphoma the second time. I met Dr. Ahmed. She was the one that specialized out there in the lymphoma clinic, and they was like, she's very good at her job. And so I met her. She was saying that I had two choices. She said, I want to put you through a clinical trial. That was the second option. The first option was a standard. Thing is, she didn't rush me into making my decision when she gave me the two options, but she said, I'm gonna let you think about it. And whenever the time comes, when we see each other again, well, I'm gonna call you back. And she said, even if you decide to stay in Louisiana, she said, I can look up some resources, and then you want to drive so far. And she said, and the next place she had told me about was Baton Rouge. So I was like, well, it's closer for me to drive to Houston than it is to go away to Baton Rouge and do treatment or whatever. But she made me feel comfortable, and she heard me out. As a paraprofessional in Louisiana, you don't make much money. I don't know about in other states, but for me, I know it was a struggle financially, because here I am, I need my job so I could have my insurance to pay for this, the things that I couldn't cover, because, the insurance didn't cover everything. I was faced with a financial decision, and either stay in Louisiana because of the fact that, oh, okay, I have Medicaid. I'm here, but Medicaid is not accepted out there. But if I want the best care, I feel like that that MD Anderson can offer me, then I need to go with the best care. I would come drive down from Louisiana and I would check in the hotel. So, and then I would stay maybe 2 or 3 days because sometimes they had like doctor's appointments a day, like blood work a day or two before your actual treatment. So I would stay down there for like 3 or 4 days before I actually had the treatment. And so once I had the treatment, I would go back to the hotel and then I will check out the next day. Long because in the beginning they would want to make sure they keep an eye on you. You know, once they give you, they have this like window of time where they monitor you. They treated me like royalty. I would say for myself, I was treated like royalty because I never got in the bed. I was laying in bed and they would just get like before that, I was just sit in a chair. But this time, here's your bed. Lay down, get comfortable. And I was like, wow, I feel good about this.